Hi there, welcome to the World of Sustainability where your academic needs are met. Welcome back. I don't come again, we don't come to another part of the lecture series, the maternal and child health. So, the topic today is the pelvis. So, why do we have to talk about the pelvis? As you can see here, you can see that the pelvis is this structure in the hip of the pregnant woman. This is an image of a pregnant woman containing the hip bone, which is the pelvis, and the fetus in the womb. So you can see that the pelvis here is an important pathway or birth canal through which the baby can pass into the world. So without the pelvis, without understanding the pelvis, there will be no way to understand how the process of child delivery or of labor or whatever aspect of child delivery, it's only possible. You understand? So this is a very, very important aspect of maternal and child health, because without it, child delivery or understanding of the process of labor cannot be fully established. You understand? So this is very important, because without them, we don't understand how it happened to born pikin. You understand? Whether it would be hard or it would be easy, and this one will make us understand. You understand? It's an area of maternal and child health or study that is called pelvimetry. You understand? There's the measurements and whatever that involves the pelvis. You understand? So the pelvis is very, very important. So moving on now, the next thing we look at here is the different parts of the pelvis. You can understand pelvis without understanding different structures, the anatomy of the pelvis. This is just a little bit of the anatomy of the pelvis. As you can see here, there are important parts. There are three important innominate bones here. They are the ilium, the ischium, and the pubis. Very, very important. The ilium, ischium, and the pubis. You call it the pubis, or you call it the pubic bone. Very, very important. So every other aspect are also important too, but these are the important innominate bones, and they are anchored to the vertebra by the vertebral, the important part of the vertebra, which are the sacrum and the coccyx. You understand? Very, very important. As you can see here, this is the pelvic inlet, or we call it the pelvic brim. If you check my lecture video, you realize I explained a little bit about the pelvic inlet. You understand? During the stages of labor. Very, very simple. If you have not seen it, go and try and watch the video to understand it a little bit better. So at this point here, we'll be looking at the other aspects too. The ilium is also attached to the sacrum by what is called the sacroiliac joint. Very, very important. It's what helps hold it to the vertebral column. Very, very important. So as I've mentioned all of that, it is also important that we mention what is called the pubic symphysis. This is an aspect that actually joins the pubic bones together. You understand? It's very important clinically, because during the stages of during the end stage where labor is about to set in, hormones help to reduce the joints or the ligaments found here. You understand? The strength of the joint, so as to allow the baby pass through easily. Very, very important. So at this point, those are the important parts. The other parts to the obstetrical foramen, this one helps in the passage of nerves and blood vessels. You understand? So because this pelvis serves as a house for the important vital organs like the uterus or the womb, where the fetus actually stays throughout the process of gestation or pregnancy. Very, very important. Then there's the iliac crest too. That's the edge, still iliac crest. Very, very important. There's the femur. The femur is just an extension. This is the femur is attached to the pelvis through what is called the hip joint. You understand? And that part that attaches is to the acetabulum. Very, very essential. So moving on, there's a little bit about the ischial spine, also very, very important in understanding the process or the idea of labor. You understand? So it's very, very important. These are important landmarks. Very, very important landmarks that helps to determine if a labor process will happen fast or smooth, or if there will be obstruction. Very, very important. So that's a little bit about it. So moving on, there are different types of the pelvis. There's the gynaecoid, there's the platypelloid, there's the android, and there's the anthropoid. Very, very important. The distinguishing features here, as you can see, is that the gynaecoid, which is the most common type of pelvis, very, very important. It's round. You know, so why is it common? Because it favors the process of labor. It makes the labor process happen easily. You understand? So very, very important. If you have not seen the process of labor, please check my video to get a grasp of it. You understand? So I talk and say this gynaecoid is a very common type of pelvis, which is it happens in about 50% of females. So it's present in 50% of females. So the next part is the platyploid. The platyploid is oval in shape. The brim, please take note, the brim of the pelvic brim of the gynaecoid is round. The platyploid is oval. The android is wedge shaped, very, very important. While the arthropoid is oval long. You understand? So very, very important. See, why is it called arthropoid? Because it's from the name ape-like. You understand? It's like an ape-like pelvis. Very, very important. The android, it is found in about 20% of females, but it's a male type of pelvis. Very, very important. Android is a male type of pelvis. Very, very important. So that's just a little bit about what the types of pelvis involve. You understand? So then this is just a summary of what the different types of pelvis involve. So they involve the gynaecoid, which is around, I said, it happens in 50%, or it occurs in 50% of females or women. Then it is easy for delivery. Very, very important. Then android is heart shaped. You understand? The shape is heart shaped. It happens in 20% of the women, and it is difficult because it's difficult in labor or delivery. So anthropoid, on the other hand, that one happens in that one is oval in shape, as I've said before, and 25% happens in 25%. It occurs in 25% of females. So it is more the ease at which it causes delivery to happen is about just moderate. You understand? So then the platyploid here is flat. It's the rarest type of pelvis. You understand? So it is very difficult. Yes, and sometimes some females might have this kind of pelvis. You understand? So such persons might have to resort to undergoing a Cesarean section to help in the process of child delivery. You understand? So later I talk and say the commonest type of pelvis are the gynaecoid, the round, the common is for 50% of the females. So the one will be the rarest, be the platyploid. You understand? Because what the name platyploid means flat. You understand? Because it's flat in nature, it causes a lot of problem if you want born. It's hard, so that kind of thing. So that's just a little bit about the different types. Then moving on, what is the relevance? We'll not talk about pelvis, we'll understand the relevance of the pelvis. One of them is that it helps to hold vital organs. I said it before, like the bladder, the intestine, it helps hold them in place. You understand? It's very, very important. The pelvic floor. So the pelvic floor muscles also helps to in making sure that our hip, our back, and the abdominal muscles helps to stabilize our upper body. You understand? So very, very important. You understand? So then in both males and females, the pelvic floor muscles, they help in sexual function, because without it, the process of reproduction cannot happen. You understand? Sexual intercourse cannot happen successfully. So it's actually very important. You understand? So strong pelvic floor also allows to maintain bowel movement, and also to maintain bladder movement too, or bladder control. You understand? Very, very important. So I talk about this, you can see this pelvis is important because they help hold our important organs like the bladder, the intestine. Also, they help stabilize our body. You understand? That kind of thing. Then also they help maintain our sexual function. When they try to do 1 or 2 packaging, they help all those who could feel bone picking, that kind of thing. Then also they help control when we piss and when we go toilet, that kind of thing. So very, very important. So we can understand this without talking about the relevance in maternal and childbirth, which is MCH. So it is important in antenatal assessment. It's also important in labor management, preventing complications, and also making informed decisions. All these things are important because without it, we cannot know, okay, can this woman be fit to carry out this labor process successfully? We have to know this very well. And the next one is the labor management, also to help determine if there will be obstructed labor and all. So then also to manage the process of labor. You understand? Very, very important. Then to prevent complications. Okay, if you know that there will be difficulty, maybe the person has a platyploid pelvis, you know, okay, this person might have to resort to a cesarean section most of the time, not all the time though. So the informed decision has to, it helps the healthcare practitioners to know what to do next with the information gotten from the pelvis. You understand? Which is the pelvimetry. Very, very important. So at this point, we would wrap up and say, okay, the pelvis is very, very important to understand the process of labor, and without it, it is a problem. So thank you very much. I appreciate it. Don't forget to share, like, and subscribe, and also follow. So thank you very much. I appreciate it. Thank you.